Thank you so much, and I'm very grateful that everyone's tuning in, and I appreciate the time and effort that has been put into putting together today. But really, what I'm most grateful for is the work of the people behind me and what they do every day to make this happen. So Commissioner, you do such a phenomenal job now as Vice Chair of the Commission. Bergen County got hit early, hard, one of the first places in America, as we all remember, unfortunately. And the county and the county commissioners and Tom Sullivan, not just on the commission, but as head of the building trades, had to respond quickly. And obviously Don and Holy Name did such a phenomenal job, like all of our hospitals. And you were hit so hard so early. And of course, the people who work in buildings, not just here, but all on this campus in Franklin Lakes, New Jersey, and Beck Dickinson BD went above and beyond to make sure that people were safe. I'm just so grateful and honored to be here. Tom, thank you so much for your leadership and your friendship and all you do. BD is one of America's great innovators in the life sciences space, and they really have gone above and beyond during the pandemic, as they always have in their history. From needles and syringes that delivered the vaccine to developing new rapid antigen tests. And by the way, this is the new one. If you don't have it, you should get it. In fact, in Congress right now, these are the ones that Congress is handing out to offices, and something that I suggested along with Tom when he sent these to me, and we started using them to test people. They're phenomenal. I recommend you get them. It's a great New Jersey company helping us get through the crisis. And Tom, again, really want to thank you for your Iron Man level leadership, and the teams of scientists and researchers here, especially those in the factory. We talked about people working 24/7 throughout the pandemic, literally making these goods, making sure that things got made, working around the clock. And of course, all the doctors, the nurses, the techs, and other experts at our great hospitals just went above and beyond, all of our frontline healthcare workers, and of course our first responders, that I'm also very grateful for. I remember very early in the pandemic, Tom, you called me and said, hey, as one of our first conversations, you said, hey, you got a problem here. The United States, we haven't placed our order for needles and syringes yet. All these other countries in the world had put their orders in, and we hadn't done it. So we knew a vaccine was coming because we've got the greatest scientists in the world working in the United States, but it would come out and we didn't have any way to deliver them into people's arms. So if we didn't actually place the order and didn't get that moving, we would have a real problem. I wrote a few letters to the White House, to the Trump administration, and I called the vice president. We got the order moving. That was good. We were lucky. Tom was smart enough to look around the corner when other countries were putting in their order. And of course, our biggest ace in the hole was that the largest global manufacturer of needles and syringes is in northern New Jersey, right, in the United States. And obviously, they were able to step up and get it done. We are very grateful. We all are. And thank you for looking out for all of us in the United States. We remember, though, that we weren't as lucky in those early months on other supplies, like ventilators and masks and gowns. Nurses and doctors used bandanas to cover their mouths, and hospitals had to ration the ventilators. Remember those decisions? Awful. And Tommy, you talked about how building trades came together to get supplies together, masks, and whatever we could find. But our heroic first responders and grocery store workers were using garbage bags for protection. Inconceivable, as you just said, in the United States of America, that's what we're dealing with. Many of the devices in our supposed stockpile hadn't been tested in years and just didn't work, right? And in far too many sectors, we had exported our manufacturing to other nations. So it was impossible to produce what we needed in short order. Like a lot of people, I was shocked by how ill-prepared we were for the pandemic and how reliant we were for critical supplies on other nations. We just didn't have the supply chain here to do what we needed. And thanks to some of the action we took early on, we're now producing more domestically, masks, ventilators, and other challenges that we faced early on. And we know things like masks and tests are critical to keep children in school safely for in-person learning and get people to work and parents to work. But over the last 2 years, they just happened. Democrats and Republicans, we came together and said we need to fund some of this work for distribution, for testing supplies, vaccine, and other critical medical supplies. The Bipartisan Problem Solvers Caucus, which I co-chair in 2020, we led the way for calling for an immediate rescue and revival plan, including rapid testing and PPEs and masks that we then led to the CARES Act in March 2020, which directed critical supplies like PPE and ventilators and medical devices be added to the national stockpile. They opened the stockpile doors, you remember this? And then suddenly we found out half this stuff didn't work because no one had actually looked at this stuff in years. A lot of the ventilators were broken because no one had tested them. So we allocated critical resources to healthcare facilities and manufacturers to help them get through the crisis, and which was obviously very important. In December 2020, we then, again, a group of us, and bipartisan House and Senate and the Problem Solvers Caucus, we worked with the administration to get the largest relief package in history, which included large resources for vaccine distribution, for testing, and other pandemic mitigation. And then in 2021, with the American Rescue Plan, again, more for tracing and vaccination and testing. We also passed bipartisan legislation, which is on a bill that I did on the strategic national stockpile for the domestic supply chain. And I'm glad that we took those steps. But here we are 3 years later, and we just don't have enough of these, right? I mean, this is the bottom line. We can't get enough of these. And Tom and the team are producing these overtime, as are other companies, right, that are producing them, including domestic manufacturers. We're trying to crank out as many of these as humanly possible. But the bottom line is we have a huge shortage. And our hospitals, right, I've been there, you got lines out the door trying to get tested, and these are antigen, trying to get PCR tests. But we just can't handle the amount we need to get kids and get kids back to school and keep them in schools, of course, and get people to work and keep them in work. And we've got a lot of people calling our office, of course, I know probably calling the commissioner as well, looking for more rapid tests. You don't have to be a scientist in a lab to know we have a real problem on our hands. I wrote the president earlier this week and asked him to increase rapid testing supplies by continuing to partner with private sector leaders like Becton Dickinson, including, and of course, continuing to push on the Defense Production Act and expand access, of course, also to newly developed therapeutic drugs and get them directly to hospitals instead of having to go to just the pharmacies. These are things I've heard from hospitals like Holy Name. Today, though, I'm here to announce new bipartisan legislation, the Medical and Health Stockpile Accountability Act, to help ensure that we don't face this problem in future crises. I've been working very closely with Senator Cassidy and several of my House colleagues to ensure this legislation has broad support in both the House and the Senate. My legislation will establish an automated supply chain tracking system that provides near real-time insight into critical supplies that are available in the Strategic National Stockpile and in medical and health supply inventories in New Jersey and across the country. This is what Tom was talking about. We just didn't actually know. And Don, you made this point as well. We didn't know what we had and where it was. I remember we talked about this as well. You just didn't know, and we didn't know where masks and PPE were, how many, where were the ventilators, did we have enough, what states were they in? And on top of the shortages, it was shocking to discover that when hospitals were in desperate need, we literally, as I said, I remember calling the White House and saying, like, there's not a list somewhere, we don't know where this stuff is. And it wasn't. A lot of us were sitting on the phone with Europe and Asia late at night trying to get shipments of masks and ventilators here. I begged my colleagues in other states to see if their hospitals had anything they could spare, an extra ventilator or a few thousand masks and gowns. I pleaded with the White House for anything they could spare from the stockpile. But there was very little transparency. You literally just didn't know where everything was. Where were all those supplies we needed? And because of that lack of understanding, there was excessive purchasing of certain products. And then we knew there were all these people, these disingenuous and fraudulent vendors, these hoaxsters, were hoarding stuff and jacking up prices. Remember this? And charging a fortune for things and actually hosing people in their greatest time of need. There was all this collusion going on. 3 years later, we have fixed a lot of it, but we still have challenges, and that's what we need to address. We just don't have a handle on the exact quantities of critical medical supplies and drugs that are on U.S. soil at any given time. We have shortages of certain supplies in some places and surpluses of others. This lack of visibility is hurting us again as we're trying to ramp up testing and higher grade masks like N95, right? These are what they're suggesting that we wear, these higher grade masks to help curb the spread of Omicron variant. In response to urgent needs to understand product availability and risk, the federal government did stand up an emergency health information collection process, basically trying to coordinate everything on an Excel spreadsheet. It was already antiquated, and it created substantial additional work for healthcare providers. So they put this spreadsheet together. Hospitals and other providers were asked to report to state and local officials, sometimes different data. It actually created redundancies and further confusion. I remember talking to Mike about this and to Hackensack and other hospitals, and they're saying it's a completely confusing system they've set up. It actually wasn't of great help. Hospitals reporting boxes and units differently from one, massive discrepancy of what was going on. So our communities needed masks and ventilators and therapeutics that were available in different places, but we just didn't know. The Medical and Health Stockpile Accountability Act that we're announcing today will help ensure that hospitals and doctors and nurses responding to health emergencies have the supplies they need when they need them, so they can provide safe, effective care for patients and not be put in harm's way. Armed with information from this inventory monitoring infrastructure, decision makers, including hospitals, manufacturers, distributors, and federal agencies, will better be able to plan and allocate supplies to prevent shortfalls and hoarding, move product from the strategic national stockpile to points of care, and ramp up production when we need it. It just makes sense. The stockpile is there for short-term stopgap buffer and measures to help with urgent needs. But it's got to be able to respond, and if we don't have that information in an organized way, it's not very helpful, right? Especially also if some of the stuff in the stockpile is not working because we're not testing it, if we're not making sure we have the pharmaceuticals and the active ingredients that we need, the life sciences have what they need to make sure they can do what they need, and of course, all of our hospitals and doctors. So instead of standing up an antiquated system, our nation needs a system that can track critical product availability from raw materials to manufacture, distribution, to state and national stockpiles, to hospital inventory. And that's how we're going to do this, so that doctors are not, dressing up in trash bags because they don't have gowns, or having to use bandanas, and that ventilators aren't being rationed off. We can't allow that to happen again in the greatest country in the entire world. With our new bipartisan legislation, the system will exist behind the scenes to make sure that we're ready, and it can be turned on in a moment's notice. It provides visibility of supplies to hospital inventories with detailed information to enable accurate, intelligent decisions are made, and that we have no problem there on the local level, and allow our leaders to make strategic distribution decisions, minimize hoarding, and support powerful and accurate prediction, enabling the nation to manage supplies during a crisis, to make available to all of the providers for intelligent purchasing so we can get this done and have the visibility that we need. Let's make sure this doesn't ever happen again, where the Strategic National Stockpile doesn't have the nasal swabs or sample tubes or collection. We talked about that, Tom, recently. It was in my office talking about the fact that we also have shortages in the supply chain right now on things like sample tubes and collection for blood, right? You don't have what we need for swabs and the tips and all these other things that we need that we should have in our stockpile. I want to make it clear that this data infrastructure is critically important, especially in a pandemic, but of course also in national emergencies like Hurricane Ida or superstorms and wildfires when we need emergency supplies. We can avoid these challenges if we take the steps now and look around the corner. Last point, if during the vaccine rollout, and we needed those needles and syringes that Tom was talking about, especially low dead space syringes such as BD Integra, they were critical in extracting the maximum number of doses from a vial. Remember, we had very limited amount of supply, and the BDs, the way they've designed their needles and syringes, you can get more out of the tube, more doses out of it, so you don't waste anything, right? Those are the kind of things we should be thinking about long term. So people were scrambling. Our hospitals were, and our long-term care facilities were scrambling to find inventory of low dead space syringes throughout the country. If we had an efficient mechanism for tracking these supplies, that scramble could have been avoided, and frontline caregivers could have focused on getting more shots into arms when we were trying to get people to get those shots. So again, let's be smart. Let's look around the corner. Let's make sure that we have the capacity and we gear it up so that we're not stuck. I know BD is trying to get as many of these out the door as humanly possible, and as our other life sciences companies, the rapid antigen tests. We've got to do more. The governor has made some available for residents in New Jersey. Obviously, the White House has announced that we're going to get out about 8 a month to families. We need to make sure that we can afford that. We need to make sure that labor can afford to give that out because these things are very expensive, and we need to have the resources for that. But we need to have testing available. People need to get vaccinated. We need to have testing. We need to have masks. All critically important for this to work, for us to make sure that we beat the pandemic. And there are steps in that supply chain piece to make sure we don't have backups. The Made in America Act, which I sponsored, helps make sure that we have those essential supplies. The PP Supply Chain Integrity Act makes sure that we're smart in what we're purchasing. Things like the CHIPS Act make sure that we have other critical supplies and that we're not facing back end on other critical things that we need for our country. But the bottom line is you only get there if you look around the corner. And I want to make sure this legislation gets enacted so that we can look around the corner here in the greatest country in the entire world, and that our best days are always ahead of us. Thanks, and God bless.